The Driving Fitness Assessment Clinic is a clinic where we look at assessing people's capacity for ongoing driving, whether it's returning to driving or continuing to drive.
It's got doctors involved as well as occupational therapists and nurses as well. And it's a full analysis of a person's medical condition in relation to driving.
The Driving Assessment Clinic is used by GPs when we're not certain about whether a patient is ready to return to driving or if we have any concerns about them continuing driving.
With the ageing population, we're getting a lot of age-related medical conditions, so things like strokes and dementia or cognitive decline, Parkinson's disease or multiple sclerosis, and how that impacts on driving as well.
When I had my stroke in February in 2011, I lost my licence because I couldn't drive, obviously.
Philip went to work on the 31st of July, had a presentation to do, and he had a stroke at work at about 8:30 in the morning. The suspension of licence is very humiliating for the person having their licence taken away.
It's a very confronting issue for a lot of people. Obviously independence is tied closely to driving, so we don't take the decision lightly, which is why we involve the driving clinic. It's a team of experts and they're used to dealing with people in a really sensitive way around this issue.
The Driving Fitness Assessment Clinic is an opportunity for patients to explore the options for continuing to drive or return to driving. It's not always the case that is achievable, but we do our best to try and achieve that where it's possible.
After I'd been doing a bit of rehab and I was out of hospital and all that, it was put to me that perhaps I'd like to get my licence back, and I thought that was a pretty good idea.
Often people think they're coming straight in for a driving test, which is not the case. It's not all patients that come in require an on-road driving test. The first appointment at the Driving Assessment Clinic will have both a nursing assessment looking at some screening tests for vision and cognition, and then an interview with the doctor looking at the details of that person's driving.
Before the patients go to see the doctor, they come to the nurse and they get their vision test, blood pressure done and their cognition assessment done.
It's not unusual for us to refer on to ophthalmology for more in-depth assessment of their vision. Or we might refer to the Department of Transport for on-road test, or if we think more in-depth on-road assessment is required, then we'll refer on to the occupational therapy on-road assessment.
We go out in a driving instructor's car with a driving instructor in the front, and they've got access to a dual brake in case we run into any issues or difficulties or the unexpected. And there's an occupational therapist, myself, in the back seat, analysing the situations that occur and seeing if they relate back to the medical condition we've done in a pre-drive assessment. I think it's the teamwork and the communication between occupational therapists and doctors, the specialists. I think the communication between the two and the fact that we've formed a good team certainly makes it more comfortable for the clients as well.
Because driving is such an important part of a person's ongoing independence, we take it very seriously and want to give people the best opportunity to continue driving if it's a safe thing to do so.